What's up, guys? Listen, I am ecstatic. I am so excited. This has been a long time coming. It's been years. I have contemplated about starting a podcast for a very long time. I've had many people tell me, Alexandra, you have the voice of a podcaster. And I thought at the time it was very funny. And I was like, really? And, I love to talk. I love to talk. Anybody know or who know me, they know Alexandra is a talker. However, I never really like to hear myself talking. And so I'm just really excited to finally take a leap of faith and to talk about the one thing that I'm extremely passionate about, and that is about health, wellness, and fitness, and how it has impacted the culture of the Black community. We are going to dig some deep wells. I'm going to bring my friends on, some experts in this area of health, wellness, and fitness. And we're just going to have very candid conversations. We're going to cross some boundaries. We're just literally going to talk about what has not been addressed and has been addressed subliminally, has been talked about behind closed doors, but hasn't been brought up to the forefront of why we as Black people cannot push past and excel in Black health, right? And just health in general and good health in general. And so I'm extremely, passionate about this just because, one, specifically because it impacts me as a Black woman. It's impacted my family generationally. I want to make change. I want to, moving forward, my children's children to be healthy. And it starts with me. It does. It starts with us now for the future. And so before I get deep, I'm already starting to dig in. Before I dig in, I want to introduce myself. My name is Alexandra Francois. I am a certified personal trainer. I've been in the fitness industry for 10 years. I started off in sports performance, working with athletes. My undergrad is sports medicine, exercise physiology. And I just, within the last really 8 years, 8 years, I've deviated a little bit away from sports performance and athletics and have grown this, passion to help just everyday people excel in good health. And I worked with the YMCA for quite a long time as a coordinator, as a director of fitness operations. And I was able to cross paths and encounter and experience, working with some amazing people, in which I was like, wait, like, this is an area where I can help make a lot of impact because, one, there was a lack of knowledge. It was a lack of knowledge when it comes to understanding how to live the healthy lifestyle. I am an avid public health ambassador. And, as I continue to grow in my purpose and understanding why God has created me, why He's planted this in my heart, it's like this fire. I'm like burning to teach everyone I encounter, hey, like, this is the lifestyle that is, change, that can change your life completely and set you up for success in every area. It's a holistic approach. Health and wellness and fitness is holistic, right? And so not only am I in the industry as a certified personal trainer and ambassador, I am also a collegiate professor in which I teach this in two institutions here in Baltimore, Maryland, in Maryland specifically, right? And so enough about me. I am like, we have to have this conversation and we have to discuss why this is such an issue, right? And how it has for the past, we see a lot of change when it comes to the pandemic, and we've experienced a lot of things when it comes to the health of Black people during the pandemic. We saw that at one point during the pandemic, Black people were being affected more than any race with COVID-19, right? Of course, statistics has changed drastically since then. However, let's talk about what's the main killer in our culture, in our race, and within our people. It's not cigarette smoking. It's not type 2 diabetes or type 1 diabetes. It's not even dementia, Alzheimer's, or sickle cell anemia. It is cardiovascular heart disease. Heart disease, right? And as I mentioned in my intro video, what are the risk factors in which contribute to heart disease? Sedentary lifestyles, improper nutrition. Now there's a list of things, right? We got smoking as well, alcohol and substance abuse. However, one of the main risk factors, and the two I would say top two, are sedentary lifestyles, not exercising daily, and not eating properly, right? Processed foods, added sugars, right? Starbucks is making a killing. Dunkin' Donuts making a killing. McDonald's is making a killing. Any fast food restaurant, really. Popeyes, they're making a killing off of us, right? But when you look at things even deeper in the system, right? I live in Baltimore City. It is 63% African American, one of the blackest cities in America, right? 62% is a big percentage, right? When you're looking at these low socioeconomic status communities, which are identified as Black communities, right? When you're looking at the region infrastructure, we got the redlining, we've got the food deserts, corner stores everywhere, right? But limited access to raw, fresh fruits and vegetables, limited access to markets and grocery stores, right? Limited access to gyms, limited access to therapists and health and wellness, mental health services, right? And so systemically, we see that in our Black communities, and I've been to many Black communities across the country. I've been to LA. I've been, I was born in New York, traveled to New York, not frequently, but often. I've been Florida. I've been, I was, but raised in North Carolina. And so I've seen many Black communities, and it's almost like the same thing. It's almost like the same thing. Limited resources in our communities, right? There's a lack of knowledge because of these limited resources. There's a lack of knowledge. And so what needs to be done, right? What we need to do to prevent and take preventative measures moving forward when it comes to making a drastic change in our community is bringing the resources that other races have in, right? People like me stepping out and talking, hey, this is what we need to do. This is what we need to do to put an end to this, right? This is what we need to do to prevent this. We're going to talk about a lot of things throughout this entire podcast series that I'm excited about, because we're talking about fighting against not only a system, but a very strong system that has been built against the Black people. But we cannot continue to use that as an excuse. We really cannot. We cannot continue to use what systemically has been, placed against us as an excuse anymore, because the knowledge is out there now. And now we got to seek it. And now I'm here so that you don't have to continue seeking it anymore. I'm just here. I'm going to give it to you. Right? We're going to talk about what we need to do and how we need to move forward and how we need to progress and how we can progress drastically in this thing, right? As I mentioned in my intro video, we're not talking about pills. We're not talking about, relying on medication for the rest of our lives, right? We're not talking about putting on a Band-Aid. We're talking about a cure. We're talking about longevity. We're talking about forever. We're talking about healthy living. We're talking about healthy living. I want you to understand, if you're a Black listener, that it is up to you to make the decision. It is up to you to make the decision. And after listening to this today, my hopes and prayers is that you make the decision to partner with me in this fight, because it is a fight. It is a fight. However, in order for us to win the war, we have to fight, and we have to fight efficiently, and we have to fight diligently. I'm excited about fighting with you. I'm excited about having this conversation. And let's just be candid. Let's just be real. Let's just be, let's be as clear as we possibly can about this thing and tackle it head on. I'm ready to tackle it head on with you. And it's going to be a very, very, we're going to talk about things that you never thought would affect you and your health as a Black person, right? You just never thought. I'm excited. Thank you for listening. Let's do this. Let's win this battle. Come on.